Health-Wise, brought to you by Winona Health. Healthy starts here.
Get down!
On Health-Wise today, we're visiting with Dr. Jake Thomas, and Dr. Thomas is the hospitalist at Winona Health, and thanks for being here today.
Well, it's good to be here.
Now, you're new to the Winona community. Tell us what brought you to Minnesota, because I know you said you were from Texas.
Yeah, I'm from Texas originally. I did my residency at Mayo, and that's what brought me to Minnesota, and I wanted to stay in the area for a while. I have so many good friends here, and decided to stay.
So why did you choose Winona Health specifically?
So when I was looking for jobs and applying places after residency, I was looking for a place with a smaller hospital that really is involved with the community and has a good work environment. And when I interviewed here, just the people I met were so nice and friendly that it really drew me to the area, and I decided to give it a shot. And I'm very happy so far. I've enjoyed my time here.
Now, your position is hospitalist. Can you explain a little bit about what you do and what a hospitalist is?
Okay, so essentially as a hospitalist, I take care of patients in the hospital. Their primary doctors will take care of them in the clinic. When they have a problem, they go into the clinic and be seen. But when they get really sick and need to come into the hospital, I will take care of them in the hospital. So my typical day is I show up early in the morning, read up on the patients, what happened overnight, go around and see all the patients and put in orders, talk to the nurses, and try to do what's best for the patient that day. Take care of them while they're in the hospital. When they're ready to leave the hospital, I send them out, give them any prescriptions they may need, and they can follow up with their primary doctor shortly thereafter to make sure things are on track.
So then as a hospitalist, you really have to be, it's probably not the right term to use in a medical session here, but kind of a jack of all trades. You've got to have a pretty broad knowledge of medicine.
Right, I do have to have a broad knowledge of medicine. So my specialty was internal medicine during residency, and that is just very broad. You study everything. Essentially what I don't do is surgery, but medical problems, I can manage a variety of different fields.
So what type of cases do you see? What's kind of the range that you run into on a daily basis?
Okay, well, a variety of different things. Heart attack, heart failure, kidney failure, pneumonia, sepsis. There's a whole bunch of different problems we see in the hospital. Stroke.
So I imagine that kind of keeps your job fresh, if you will.
Oh yeah, it keeps it really interesting because you see a lot of different things. Sometimes you'll see kind of the run-of-the-mill problems like pneumonia, and other times you'll see really rare diseases, complicated patients. So it's a nice mix for me in that I get to take care of common problems, but also I get to take care of complicated patients as well.
So as a hospitalist, you handle a broad range of medical cases. How do you keep up on all of that?
Really, you read a lot. Read, and read some more when you don't know about something. If you got a patient that's confusing you, you can look up the latest information on the internet and scholarly journals and try to figure out what's best to do for that patient at that time. You can always talk to your colleagues as well and run things by them and see what they would do in that situation.
So that kind of falls back to what we talked with recently about with Dr. Parker about in that care team environment. It sounds like you're a pretty crucial part of that.
Yeah, so the care team environment's very good because there's the hospitalist. Sometimes we'll have a doctor from the clinic helping us out in the hospital when it gets really busy. And the whole care team, social worker, nurses, pharmacists, and everyone works together to try to do what's best for the patient and make the patient stay there in the hospital as fruitful as possible to get them feeling better.
What benefit does having a hospitalist play for not only the patient, but also for the family as well?
I think it's very useful in that we are used to working in the hospital. That's what we do. We don't take care of patients in the clinic. And we become very familiar with the hospital environment and how to do things efficiently and the best way of doing things to take care of patients in the hospital. And so I think the whole care team model with a physician, nurse practitioner here every day, in addition to social work, pharmacy, and all the nurses, everyone works together very well, and we know each other very well from working together, and it helps us take care of the patients in a more comprehensive manner.
Well, Dr. Thomas, thank you so much for talking with us today, and welcome to Winona.
Thank you.